I invite Justin. Thank you very much. Take care.
Hi everyone. Thank you for having me. Um, yeah, if you're hearing some background noise, that's probably because of my laptop. My speaker is, kind of old. I had my work laptop actually, and I had presentation and everything, but unfortunately, I left it at work. So I had to use my home laptop, which is not in good shape. So apologize for the background noise. The background noise will only come when other people are talking, not when I'll have to mute it at certain points if other people are talking. But um, you know, as I was graciously introduced. I'm an LPC and an LCDC. I'm working in a substance abuse treatment facility for the past maybe about 5 years now. I've seen probably hundreds, if not thousands, of people suffering with addiction, from all cultures, backgrounds, socioeconomic status, right? And, you find that addiction kind of like um, it affects like all people, right? So without discrimination, right? And so, oftentimes it's kind of hard to like identify like, hey, what is the cause of like addiction? Why do people suffer from addiction? Why do some people develop, an addiction in the same household while majority of the other people in their household does not, right? Um, so, the hope is, at the end of this, like short little presentation now talk is that we can kind of like identify conceptualize why people form addictive behaviors, some of the causes. Also, we can hopefully at the end of this identify uh, how do we treat it? How do we treat this disease, right? And I also like want to talk about like, hey, why do people fail at getting sober? You look at um, the rates of recidivism. Why do people relapse into their substance when they're trying? It's very high. And so like why do people constantly fail at getting sober, so those are my hopes for this presentation. I also hope to get some feedback from you guys at any given point. If you guys have questions, like feel free to you know uh, be involved and ask questions, and uh, so we'll just dive right in. Okay. So first of all, like we talk about, like identifying addiction, right? And like how do we start to identify addiction, right? Actually, before I get into that, let's talk about causes of addiction. And when we talk about causes of addiction, it can mean like it can look very different for a lot of people, right? So I like to talk about it in like a couple of ways. I can talk about it from an attachment perspective. I like to talk from a stage perspective, so different stages in the life cycle. I want to talk about that. And firstly, I also want to talk about it from a physiological perspective, right? When we talk about it from a physiological perspective, this is something that we talk about. It's affecting the body in some type of way, right? We're often told that addiction is a disease, right? But medical science has adopted addiction as a disease. But most people, when you tell them that, they don't want to accept that. They would rather look at, addiction as a self-control problem, a willpower problem, right? They don't want to accept the medical science behind it, or they don't know the medical science behind it, right? When we talk about the medical science of an addiction, from the physiological perspective, what it's affecting really is the brain, on the physical level, right? Hence, this is why it's a mental disorder, right? There's a chemical imbalance going on in the brain that is not normally functioning, right? And so when we're talking about, hey, when the brain is not normally functioning, what is not functioning correctly, right? So when we can really think about it, addiction is it's a disease of dopamine in the brain. How we experience dopamine. Dopamine is this chemical in the brain that is responsible for how we feel pleasure. Okay. So pleasure, when we feel pleasure, we have a little bit hit of a dopamine. When we're not feeling pleasure and feeling things are kind of like depressed and boring, There's not a lot of high levels of dopamine in the brain, right? And, and so like what triggers this response of dopamine in the brain? And this is when we start to talk about, hey, the stage perspective, and when we start to talk about our attachment styles, right? Um, Real quickly, I'll talk about attachment styles. Attachment styles is something that we talk about as, like a clinical term, but it's actually just this term that we call love. It's like a fancy clinical term for love, when we feel the sensation of love for things, right? So we can have attachments to many things, obviously. We can have attachments to our parents, we can have attachments to our friends, we can have attachments to things as well, right? We can also have attachments to our like occupation, right? And so there are like kind of four major attachment styles. Firstly, they're secure. The secure attachment style is normal. You want to have a lot of secure attachments. The other three are kind of attachment styles that are deficient, right? They're either anxious, avoidant, or disorganized. The last one, disorganized, is basically an attachment style where a person's experienced a lot of trauma in their life. They've been physically abused, emotionally abused, sexually abused. So they have a disorganized attachment where they're don't know how to interact. They all have like a lot of mental disorders like schizophrenia, personality disorders, BPD, um, narcissism because of their trauma, right? The other two are way more common, like anxious and avoidant. So sometimes you're anxious in your attachments, meaning that you're afraid that you're going to lose them. Maybe you've been abandoned before, so you feel like um, you're always hyper vigilant that you may lose your relationships. Or it can be like in your job, you're always afraid that you're going to lose your job, so you're always feeling very anxious, right? The other attachment style is called avoidant. Avoidant attachment style means it's like you're always afraid, and so you kind of avoid your attachments, right? So like say like you're slightly know you're around a partner or a parent that like likes to shout, so you don't like being in the same room with them. You go to the other room all the time, right? Or like you don't like your job, so you try to leave your work early every single day, right? Because you just don't like it, or you're late every day, just avoiding what you're these attachments, right? What we're after is like a secure attachment, right? A secure attachment is like, hey, you love being around your parents, you love being around your kids, you love being around your job, you want to have a lot of secure attachments in your life. Um, when you don't have a lot of secure attachments, say you're anxious or avoidant, there's a deficiency in our attachments, right? And so when there's a deficiency in our attachments, these deficiencies have to be made up in some way, right? And so, like, how do most people make up deficiencies in attachments? A lot of times it's maladaptive, right? Maladaptive patterns of behavior. They either get depressed, they get anxious, or they start to use substances to cope with it, right? They start to drink. I want to avoid my parents, or I want to avoid my spouse, and it's causing me a lot of anxiety. So I want to drink to deal with my anxiety, right? If you have a secure attachment, you're very less likely to to use coping methods, maladaptive coping mechanisms, right? So this is part of like why people start to develop addiction issues. They have a lot of deficiencies in their attachment, right? So the next thing is like I want to talk about is like I want to talk about why do people formulate certain types of attachment styles, right? And the formulation of attachment styles and like the combination of dopamine, right? The substance we talk on the physiological level, right? So I'm gonna share my screen real quick.
Yes.
Okay. So what I have here is, this is called Eric Erickson's psychological stages, right? Um, he's a stage theorist, and he was one of the earliest stage theorists, right? Basically, in stage theory, basics these first stages in life, each stage in life has to be successfully completed in some way or form. If they're not successfully completed, people tend to develop some types of maladaptive patterns of behavior, or they develop low self-esteem or any number of things, right? So what I like to do is like I like to talk about addiction from a stage theory. What ends up happening when we don't successfully complete these stages, and expect also talk about like dopamine, right, and its effect on dopamine, right? Okay. So the first stage that we have is 0 to 1. It's called trust versus mistrust, right? And the virtue is hope. It's trust that basic needs and nourishment and affection will be met, right? Um, so in this stage, like when you're a baby, very early on in your life, hey, what is like the most important thing to a baby? And you'll like obvious answer is your parents, right? When a baby cries, mom comes, picks up the baby, holds them close, like what they talked about in the hospital do with the newborn babies, like give a lot of skin to skin contact, feed the baby, make sure the baby sleeps, right? So when you're really looking at dopamine from like from the early stage of 0 to 1, parents are the primary source of dopamine for a baby, right? And so when a baby is well cared for and nurtured and parents are very attentive, babies experiencing dopamine in a very healthy way, right? um, Also is building very secure attachments at that point with the parents, right? Conversely, like say, hey, parents are heroin addicts, right? They use drugs. And so when the baby cries, um, the parents don't come. They're not attentive to the baby's needs and they cry and cry and cry, right? So very early on, the baby is learning to mistrust parents. It's developing what's called an attachment style that's deficient in some way. And also it's not experiencing dopamine in a healthy way. It's already deficient, right? So when someone is deficient in dopamine, the more likelihood is that they'll seek external uh, hacks to dopamine, which is our substances, right? So but like most people, they tend to have really good parents, right? They have very attentive parents, and even parents that are not really good at parenting are pretty good at handling a baby because it's kind of straightforward, right? So then you get to like the next stage of 1 to 3. This is where autonomy versus shame, right? And this is develop a sense of independence, which is very important, right? Eric Erickson talked about in this stage that potty training is a very big point in development at this stage, right? How parents go about it, right? Are parents developing a sense of autonomy in these kids when they're going through this process of potty training? Are they encouraging? Are they okay with them making mistakes and stuff? Or are they instilling this virtue of shame, right? They're angry at the child. They're making them feel bad about, having accidents or not getting it quickly enough, right? So when they're developing a sense of autonomy, they're experiencing dopamine in a very healthy way. When they're experiencing shame, they're not experiencing dopamine in a healthy way. Again, in early childhood, in this stage, parents are the primary source of dopamine, right? They're they're going to be like very important in the development of a child, right? And next is 3 to 6, right? Initiative versus guilt. And in this stage, this is where kids start to go explore the world in some sense, right? They're going to preschool, they're having interactions with other kids, they're starting to explore the world, right? um and also is like, hey, it's not like, again, like parents are very important in this process, right? Are they instilling a sense of initiative? They're saying it's okay to go and explore the world, or are they like helicopter parents and they're like making them feel guilty for doing things, or exploring the world, right? They're saying, hey, you're doing a bad job. So again, like if they're instilling initiative, higher sense of dopamine. If they're instilling guilt, there's a deficiency, right? School age, 7 to 11. This is where kids begin to become more self-aware about stuff. They start to notice the differences between themselves and their peers, right? Some of them start to know that, hey, I'm a little bit smarter than some kids, or I'm a little bit more, like athletic than some kids. Or conversely, they'll say, hey, well, actually, I'm starting to realize I am. not as good at school as some of my peers, or I am not as athletic, or I'm not as good looking. So they're either developing a sense of industry or inferiority. They're starting to feel like they're bad. So if you're feeling inferior at this stage, you're not experiencing dopamine in a healthy way. If you're, developing a sense of industry, like, building a sense of competence, you're experiencing dopamine in a healthy way, right? Uh, the next stage is 12 to 18. And you hear like this is a stage where there's a big shift in how people experience dopamine. In the previous stages, parents play a big role in the role of dopamine, right? But then now it switches from parents to being your peer group, right? And hence, this is why I call it the identity versus confusion stage, right? Is where kids want to fit into their social peer groups rather than, like care what their parents think, right? So they want to identify as the athlete, or they want to identify as the studious student, or they want to identify as, you know, a rebel, or a gangster in their school group, right? And so whatever their peer group is doing that they identify with, they want to do what they're doing, right? If their peer group is drinking and smoking, they want to do that. If their peer group is not drinking and smoking and studying, that's what they want to do, right? Also, there's a part where they want to be a part of a certain peer group, but they get rejected by the peer group. They say, "Hey, I'm an athlete," and I go to the athletes, but the athletes say, "Hey, you're not an athlete. You're not good at sports. Get out of our peer group." So they get a lot of confusion about who they are, right? So when they're confused about who they are, they become, this is a sense of like, hey, I should become deficient in dopamine again, right? I'm not really happy with how my life, how I view myself, right? Um, so, but if they sense that if they're accepted by their peer group, they feel really, well loved and nurtured, right? So this is a big part of how people develop a sense of dopamine, right? The next stage is like intimacy versus isolation. And this is the year where young adults start to transition into being adults, right? I know they're in college age kids, and they're meeting partners, and they're finding their jobs and finding their careers and going on to their next stage of life, right? And so if they're developing, if they're finding their partner and they're finding their career, everything's good. But if they, on the other hand, this is the age where a lot of people, especially in this society, are struggling. 19 to 29, they're struggling to find partners. They're struggling to find jobs. They're struggling to find jobs that are can support their cost of living. So they feel very isolated. A lot of kids, they're still staying at home with their parents. They having a lot of despair about finding the right career, right? And say like, hey, your peer group moves on, they get married, and they're having a wife and they're starting to have children, and you're not moving on, right? So they're feeling very isolated. You call this the failure to launch stage, right? And so if you're having a lot of intimacy and you're moving on, everything's great, dopamine in a healthy way, isolation, um, there is no, you know, there's a deficiency in dopamine, right? Next stage is middle age. You have generativity versus stagnation, right? And so say, hey, you found your partner, you have your career, you have your job, you have your kids. Everything's good outside on paper. But then you ask yourself, hey, like, hey, what's next? And you're really like asking yourself that, and you find, hey, there is no answer to that. I'm actually kind of stagnant, there is no more growth. This is going to be my life for the rest of my life. And so a lot of people feel a lot of sense of dread knowing, hey, I'm not growing in any type of new way. So in this stage of life, learning how to grow is a very big important part of experiencing dopamine in a healthy way, right? This henceforth generativity. Generativity means generating, right? Generating and growing in some way, right? So maybe you can't grow in your career. Maybe you want to decide to grow in a spiritual way. Maybe you want to decide to grow in in your health, or you want to learn different types of hobbies, you learn different ways to grow. If you don't have any ways of growing and you're stagnating, life is going to be kind of hard to deal with, right? Last stage, integrity versus despair, right? Integrity is, like, hey, you look back on your life and you're very happy and content with how you lived, right? And you feel good and you've developed good habits and good connections, and you even if, like, you retire from your job, you retire, you feel like, hey, I still have many things to do. I have a good social connection. I have a lot of things I want to do and accomplish, and you have a lot of integrity for your life, right? Despair is where, like, hey, a person goes to retirement age and they don't know what to do. They're kind of like dreading their death in some sense, right? Or they're dreading the way the rest of their life is going to go, fearing old age, right? So you look at despair as like, hey, for example, like, hey, you have a lawyer, you have a doctor, and they had very great careers, right? And they spent all their time working. The whole social circle was at work. They spent you know, hours and hours of work, so they didn't develop connections at home. Wife and kids are strangers. The kids treat them like an ATM machine. They only want money from them. So when they retire, they don't go to work anymore. No one identifies them as a doctor anymore. So they're feeling identity confusion. Now they have huge blocks of time. They don't know what to do with their time. Kids and parents, kids and spouse, they don't know how to talk with them. They went on with their life. So they have a lot of despair, right? I've encountered many people at the age of 65. They had never had an issue with drinking at all throughout their whole life. But when they retired, they developed, alcoholism to like the worst degree, right? Because they didn't know what to do with their time, you know? And so, like it's actually very common people to develop alcoholism. So, I look at, I share this is because, at any given stage, people can develop addiction problems, right? So, you find that, and some people develop addiction between 30 and 64, or they develop in 19 and 29. Some people develop addiction as early as 12 years old, 12 to 18. Some people start experimenting with alcohol and addiction at 7, you know? And so, like, why do people develop in these, addiction at different stages in their life, and you find that, in some way or form they start to struggle at this age. They start to have confusion at 12 to 18, or they felt isolated in their early adulthood. They felt stagnant and they start to feel stagnation in their middle age, right? So a big part of it is, this dopamine from the environment. So how do you get dopamine from your environment? Dopamine from your environment comes from achievement, being recognized for your achievements. Hey, people start to say, hey, you're a really smart person. Or, you develop skills, right? Say you're a musician, right? You practice hours and hours and hours at playing the piano. Then after playing the piano for hours and hours, you nail a piano piece very well. After nailing that piano piece, that's when you get a hit of dopamine. That's when you get a sense of accomplishment, right? So in reality, like, getting dopamine from the external world is actually very hard earned. It's not easily obtained, right? And you find that, people develop addiction problems is because they don't experience enough dopamine from the external in the environment, right? And so then alcohol comes into the picture. Say you start to experiment with alcohol at 12 to 18 years old, and you're feeling very confused. Your peer group has rejected you, right? So you drink alcohol. If you have a genetic predisposition to addiction, what ends up happening is when you take a sip of alcohol, your brain is flooded with dopamine, right? Most people don't experience this. Like most people, if you're an addict with alcohol, you experience this very intense sense of euphoria, even from one drink, right? And me being in recovery, this was how it was for me. The first time I took a sip of alcohol, in my 12 to 18 years old, it was like, oh my God, what am I missing? This was what I was missing my whole life. I felt a sense of intense euphoria. And what my brain said is like, I can't get enough of this, because the dopamine is flooded. So like most people, when they take a sip of alcohol, it's not a big deal. They just put it down. They say, like, I can take it or leave it. If you're an addict, with the genetic predisposition, you don't want to stop. That thing that says stop is not there. You just want to keep going and going, right? Some people, they can stop early on. They're not immediately an addict, right? It takes a lot of time for them to develop addiction, right? So from the age of like say 12 to 18 to 50, you're drinking, right? And you're not experiencing a lot of dopamine from the external world. You start to develop a dependence slowly on this chemical source of dopamine, right? Until like you can only experience it from your substance and not from, the environment at all, right? And so you're also building pathways in the brain. There's another chemical responsible for learning where you get dopamine from, and that's called glutamate. Glutamate marks every experience that leads to dopamine, right? So, the more and more that you use alcohol, this chemical glutamate is learning this connection between dopamine and alcohol, right? And for some people, it can take a very small amount of time to develop that connection for good, or it can take a very long time, right? So when a person's like really an addict, right? Really addicted to alcohol, um, they the addiction moves from the rational side of the brain and it moves to the subconscious, right? The subconscious, the automatic process, right? And you find that like, hey, people, even though like, hey, they know drinking to this degree is really bad, they rationally know that, hey, it's going to destroy my relationships with my parents, it's going to relationship with my family, I'm going to lose my job, I'm going to go to jail. Rationally, they all know that. But the rational brain is no longer in control. It's on the subconscious side. The addiction is, adapted as um, a survival instinct, right? Because this is where the brain has learned over time that, hey, when I'm happy, when I'm sad, when I'm experiencing any emotion, this is how I deal with it, the stressors of life. I deal with it by drinking. So it's a automatic response. It's a subconscious response. And so, like, hey, when you start to treat addiction, you know, you're trying to get rid of this, the addiction. The brain does not want to let it go. It's a survival instinct. It feels like it's dying. It feels like it's being attacked when you say stop drinking. It's going to use all its ego defense mechanisms in order to, stop people from quitting drinking, right? You know, any questions so far? I can move on, a bit, and so like we've gone from, kind of like identifying, hey, why people, develop addiction practices, right, or develop addiction, and now it's kind of like a big glaring problem. We have a addiction practice, so it kind of like affects like every area of life, right? Um, I think like first is like now we want to like identify addiction. Like how do we like like we want to say like, hey, when do we realize, hey, addictions move from just casual use to an actual addiction? Like how do we identify that? And so that's a very nebulous question, to be honest. It kind of depends, right? A lot of people want to say, hey, if a person drinks every day, they're an alcoholic. Or if a person is, doing this or this, they're an alcoholic, right? Um, in reality, like it actually doesn't matter how much a person drinks to be an addict, right? You find in like certain stages of life, a long-term drinker, um, when they're really poor in health, their liver's not functioning well, they can have one drink and it can be really detrimental to their health, right? Or it can cause a lot of problems. So, we don't judge alcoholism about by how much a person drinks, right? A lot of people, they don't even drink every day. They probably drink like once every, like, once a year. And then even that one time they drink, it causes a lot of problems, right? So, when we start to identify an addict, we have severe users, we have moderate users, and we have, kind of mild users, right? And on the severe, it's easy to identify. A severe user is a person who probably does drink like all day, every day. They have no relationships with their family. They have legal troubles. They have health issues. They have financial problems, and they have interpersonal conflicts, right? So it's really identified the severe user, right? The moderate user is also kind of easy to identify too. So I mentioned like kind of five areas. We have the financial area, we have the health area, we have um, the legal area, we have the interpersonal relationships, and we have it's kind of blanking on the moment, but we look at these five areas, and if they're being affected, if even one area is being affected, we can start to say, hey, this probably person probably has an addiction problem. If none of those areas are affected, we probably can say, hey, this person probably does not have an addiction problem. Even if a person drinks every day and drinking like 4 or 5 drinks or heavy drinking, and they don't have problems with work, they don't have problems with their health, they don't have any interpersonal conflicts, they don't have any legal troubles, you know, it's not fair to label them as an addict or an alcoholic, right? They're not experiencing any type of detrimental effects. They're not reporting any types of negative effects to their mental health. So, you can't say, hey, this person's an alcoholic or addict, right? Um, that's probably very rare if a person drinks every day and is not experiencing any type of issues, right? Um, but we have the moderate user or the mild user, and they still go to work. They're still having good relationships with their family, but they're probably reporting like, hey, a little bit of like negative mental health effects or physical effects. They're feeling kind of like tired, and they're feeling like a little bit depressed, and they may say like, I'm having a hard time stopping drinking. I try to stop, but I end up drinking anyways. Would we classify that as an addiction problem? Yeah, we probably would. We'll say at the very least we'll say this is problematic drinking behavior, right? And so we kind of have like varying degrees. It's a spectrum, not one case is the same. We have varying degrees of use, right? And so that's why a lot of people, they refuse to believe they have an addiction problem or problematic use, because the view of an alcoholic or a person addicted to drugs, they have the vision of a person living under a bridge or homeless or living at home and being that sloppy drunk at a party, or causing a lot of issues. They view that as a problem. But most people with drinking problems, they relatively are functioning people majority of the more of the times, and they just don't view it as a big problem, right? You find that when they have that attitude, alcoholism is a very progressive disease, and one stage of life is not really that big of a deal, but as they continue to use more and more and more, it becomes worse and worse and worse. It becomes more problematic, right? And so a lot of people hold on to false use and saying, hey, I'm going through some difficulties in my life. I was just going through a rough patch. Once my difficulties pass, I can go back to drinking how I used to drink, right? But what we talked about is, hey, these dopamine connections, right? The impact on our brain, right? The physiological effect. So at a certain point, there's a point of no return. The brain has built a connection, you know, so there is no going back to the way I used to drink, actually, you know. Um, so a lot of people like they don't want to believe that they can't drink in a normal way again, right? And there's a saying in AA, you know, once a cucumber becomes a pickle, there's no becoming a cucumber again, right? Once a pickle, you are a pickle, right? And so once you develop addiction, there's no going back to normal use ever again, right? So like now that we kind of like, try to identify like these things that, so to kind of like summarize that section of like, hey, how do we identify addiction? It really just depends. Is it affecting, you have to ask yourself, is it affecting your health? Is it affecting you financially? Are you having legal troubles? Are you having a lot of interpersonal conflicts? And if it's affecting your occupation and job, you know? So if you have a loved one that's suffering from addiction and it's affecting like their health, yeah, they probably have an addiction problem. If they're having legal problems, they're probably an addict. If they're having financial problems, they can't afford what they're doing, then they're probably an addict. If they're having health problems, even mental health problems like depression, anxiety, because of the result of their drinking, it's a problem, right? You know, and so that's how you kind of like I objectively identify someone suffering with addiction problems, right? So now, like like I want to kind of get in like really quickly. It's like, hey, how do we begin to treat this addiction? And addiction, it's a very difficult thing to treat, and a lot of people fail at it. First there has to be an acceptance of a problem. You can't be in denial of it, right? And how do people come to acceptance of this? And it comes down to, at the end of the day, a lot of suffering, a lot of pain, right? And you have to like kind of like say, if we talk about from a dopamine perspective, this pleasurable, effect that we're having. When you're a very severe addict, drinking or using drugs is the most pleasurable thing in the world for you. You know, your parents, your family, your children, your hobbies, your job. None of those things are going to compare to your addiction. It feels so good, right? So you're asking somebody when they're giving up their addiction to give up the most pleasurable thing in their life, right? And you find that initially when they try to do that, life is very hard to live. It feels it's a very huge struggle. They don't have any sense of pleasure, any sense of purpose, right? So to get to that point of like, hey, and why is that? Because the dopamine is an imbalance, right? You're not experiencing pleasure. And so you have to ask them to wait for this brain to recalibrate and start to feeling dopamine in a healthy way. But most people can't wait, right? How do people build up the motivation to wait, right? It's because they suffer too much because of their addiction, right? They hate themselves. They have low self-worth. They come to a point of realizing it's better not to experience any pleasure at all, to live like that way that they've been living, right? So when people really get serious about addiction, they come into acceptance, right? And that's why you talk about step one in AA, starting admitting you're powerless over alcohol, right? And step one is like probably the hardest, really admitting that, I'm powerless, my life is going in this really bad way. So it's a very humbling experience, you have to really be humble to accept help and say, hey, I don't know how to live my life. And so the only way a lot of people get there is by suffering more and more pain. They get more and more legal troubles. They lose a lot. You find that the people that end up getting sober are the people that lose the most. They lost their family. They lost their jobs. They're homeless. And because they have no choice, right? And so these are the people that, are more accepting of help, right? Um, with that being said, it doesn't mean you have to lose everything to be, to surrender, right? We talk about this as like an emotional bottom, right? Plenty of people are millionaires and billionaires decide to get sober. There's plenty of people out there that are homeless and crazy and still using and drinking, right? So it doesn't mean you have to lose everything. It's a more of emotional suffering, right? And so when you take out like something that is like the most pleasurable in your life, you have to really replace it with something equally as rewarding and as powerful as your addiction, right? And this is where we get into existential concerns. This is where we talk about AA as a spiritual program and all of that, right? Me personally, I'm not a very spiritual person. I don't really believe in the church anymore. And so like when I was going through my process of an addiction, my dad, he's a very prayerful person. And my brother's a very prayerful person. And they got sober by going to church, being very involved in church life. And they very much wanted me to go that way as well, but for me, like it was very hard. I couldn't, it was not a way that I possibly could go, right? Um, I decided, to go a different route, and I, one second, I see. Sorry, my son was there. I went to a residential treatment center, right? And they were telling me to go to AA. And when I went to AA, I found like very much it's kind of like church. They're talking about God a lot. They're talking about the 12 steps. The 12 steps is, it's based on the Catholic confession, right? Step four and step five is basic confession with the priest, but instead of a priest, you use a sponsor, right? Um, so I'm having, I had a lot of issues. I starting to have a lot of issues um, with AA because I really wanted to be sober, and I was scared to relapse and drink again. But I found like, hey, if this is the only solution for me, I'm probably not going to be sober because I'm not feeling the same way like how this other people were starting to talk, right? Um, so then, luckily, I started talking with my counselor, and he said like, hey, if this is not working for you, if church is not going to work for you, if AA is not going to work for you, you're going to have to find a different solution. You have to go search, right? And then I didn't even know that was like a possibility. Like search for what? What do you mean? How am I going to fix this, right? And so like made me start to like really try to conceptualize, hey, what is church doing for people? What is AA doing for people that makes people want to be sober, right? And it kind of basically comes down to like three major points, right? It's community, reflection or introspection, or service work, right? And so we have to really build like a community first, right? When you're an alcoholic or addict, you feel very isolated. It's actually very hard to really interact with people. You probably find you're more comfortable being alone, right? And why do people develop that? You know, is because they often are very much betrayed in their life. They feel invalidated. People put them down, or they tell them not to express their feelings or their troubles, right? You know, Isaac, sorry, Isaac, can you turn that off, please? So they feel very isolated, and so people learn not to share their feelings and thoughts with people. We're very much conditioned from a little kid to an adulthood to not really show ourselves. We're especially in the Malayali community. We're like, hey, don't tell anybody anything. You know, don't tell people what you're doing. Don't tell people this or that, right? So you become very secretive, become very ashamed, right? So a big part of healing is actually letting people in and letting people see you, and letting people know that hey, you're not doing well. I have sadness, I have depression, I've done things that I'm not proud of. And you open yourself up to this community, but the community has to be safe. The community has to really genuinely love you and accept you. They are not judgmental. So like really finding a community where you really feel safe and not judged and loved no matter what you do. It's hard, right? Um, People find that hey, that can't happen in a church community. That can't happen in my social circle, right? So that's why they go to because when they go to AA, everyone there's an alcoholic and addict. They understand. They will say like, hey, I've done this before. So a big part of healing is take down the mask that we're all wearing and be a real person and be in love and accepted with that. And that's a hope that we have for a family, right, as well, right? You find in the modern world, families are getting smaller and smaller, right? It used to be like families lived in big villages and big communities, and extended family were close to all the cousins and everyone were all together, right? You felt safe. You felt your family. You had this blood connection. So you felt very safe. But now, everyone's isolated. Everyone lives in different parts of the world, don't see each other. You may Zoom, people don't see their parents. Also, the parents are not safe. So everyone feels very alone, right? So it's a big part is build connection with people, community. Next is, that introspective piece, I talked about the 12 steps, step 4 and step 5 is like confession, and you can go through church and do that. Go through the sacraments, observe them, and um, you look at every religion and every philosophy, they have a way of introspecting. In Islam, they have 5 pillars, and Hinduism and Buddhism, you have meditation. There's a lot of different ways to introspect and reflect. In the modern world, modern society, it's like going to therapy, go to individual therapy, go to group therapy. You know, reflection and introspection is understanding that, hey, my life is not going good. I'm acting out in self-defeating ways. So I need to learn how to develop good habits and get out of my own way. What keeps drawing me back to these bad patterns of behavior? Learn to develop coping skills. And so people use the church to cope. People use AA to cope. There's a number of ways to cope. And so this is a big part of it, right? And lastly is service work, getting out of this egocentric mind that we have. Service work is just giving back to humanity because inherently we're selfish people. We really care about ourselves. We really care about our own problems, our own uh, family, our own job. And so when we live like that, we live in a very small world, a very small pond, right? And when we give back in service and start really understanding the suffering of others, we get to a really big perspective about what life is, right? You find that, like many people live very superficial lives, very not really understanding how precious life is. They act like they know everything. They act like they know what's going to happen, what's going to happen with the world, what's going to happen with their kids, what's going to happen for us. But in reality, you look at how big and mysterious this world and universe is. It is profoundly very hard to wrap your head around it. And when you do service work and you concern yourself with the existential concerns, you bring back mystery and wonderment back to life. You know, it becomes a very beautiful and precious thing, right? So interacting as a counselor or as a therapist, when I'm talking about really working on addiction issues, I try to like, hey, any plan is building community, building reflection, and building service work in their life on a daily basis, right? This has to be a daily thing. It's not like something you do once a week or once a month, right? It's really re-changing the way that you live, right? Before we lived a hedonistic lifestyle. It's only about pleasure. It's only about what I want, right? Now it's about living something kind of different, right? A different type of lifestyle. And it's not an easy process. That's why people need a lot of support while they do it. They need a lot of people doing the same thing, right? Saying the same thing because the brain plays tricks on us, right? So it's really important that we start to develop these things on a daily basis. And, you find that there's a lot of magic, a lot of blessings along the way that come through this addiction process, right? So basically that's all I got for the moment. So like if you guys have some questions or concerns, hopefully that made sense to you guys. Uh, I can take a few questions if you have some.
Hi, Justin. My name is Ruby. First of all, would just like to thank you so much. It was very, very impactful. A lot of great information. I screenshotted a few of the things that you had as well to look at for later. And I just wanted to ask you, as far as being a not an addict and a family member of addicts or previous addicts or just dealing with that, what is in your opinion, one of the most beneficial and healthiest and I guess effective way a family member could support their loved one through their addiction by helping them get the help that they need, identifying, loving them in a way that is conducive in getting them towards the steps towards recovery.
Yeah. That's a good question, and it's a very difficult question, right? Because you find like every situation is a very different, very different dynamics, right? So like first I would say is like for the family member to get their own support. They go to therapy, they have their own life, they build their own life, right? And if a family member is willing, you'll go into family counseling, and you really identify the kind of dynamics because it's not a one size fits all approach, and like I mentioned this before, and I tell people it's like when you're dealing with your family members, and I'm not going to ask any family member to turn their back on their family member, like really stick really hard boundaries on them because at the end of the day, when they're a severe addict, there's a good chance that they will die. And are you okay with making that choice? You know, and a lot of family members are not, which is okay. It's fine. They're not okay with their family member being homeless. They're not okay with their family member going through all these things. They're saying, I rather have them suffer through addiction. Um, and then some people they feel like they need to do that, which is fine. That's fine too. Whatever a family member chooses to do, it's fine. If you want to be the person that, hey, is not going to give up on the family member and always be like, hey, pushing for like, hey, let's go to treatment, let's go to therapy, let's do all these things, go for it. Go do that, But like also it's like, hey, you have to develop your own life. You build, kind of like the same thing, for an addict, like when a person is newly getting sober, they find like, hey, their family is really upset with them, a lot of anger. They don't believe that they're going to get sober, right? And oftentimes I tell them this, like, hey, when you really change, it has no choice but to affect your loved ones first, right? You know, and it will rub off, and they'll see that. And I feel that's the same for the family member as well. When they start to change, make real changes, real positive changes on themselves, it will affect them in some degree, right? When you start setting like really healthy boundaries, when you start, having your self worth and self esteem and your own life, that may trigger something in them to, you know, get help or start to look at things differently, right? So it is again, like, hey, work on yourself. I hope that answered your question if that helpful. Like in the early ages, it's very hard, to really kind of like see like like we have to ask, hey, like hey, is your kid having like really instances of use? Like, are they drinking? Is their peer group drinking, right? Or are they smoking weed or using drugs, right? Are they having bad grades, or are they showing less interest in their activities, right?
Yeah.
um are they isolating? Are they moody? A lot of teenagers are moody anyways, but are they moody to another level, right? A lot of mood swings, right? Are they isolating more? Have they ever come home drunk? Same thing, legal troubles. Are they fighting with people? Um, irregular behavior. I have like some adolescents that I work with. The parents never really noticed that they had addiction problems, but the adolescent will tell me, there would be days when I walk in there, I'm really happy, I'm really energetic and really good, and talking to my parents because of the drug that they're using like Adderall, right, and amphetamine, right, and they'll be really energetic and happy, and they're really talking to the parents a lot, and then 3 days later, they won't get out of bed, they're very depressed, you know, and they're getting really angry and upset. So like you look for like mood swings, right? These are good, good indicators of like, hey, something's probably not going right, you know.